Hey everybody, I just wanted to give a quick briefing. This is from the CDC about the corona, the Karachi. So I'm going to start it off at 4 minutes and let it keep recording until I have to leave to go to work. And I'll leave a link down below for the whole video if you want to watch the rest.
Share with you some of the specific recommendations made in the document I mentioned last Friday, including some of the steps we would take here if needed. This document is called Community Mitigation Guidelines to Prevent Pandemic Influenza, United States 2017. It draws from the findings of nearly 200 journal articles written between 1990 and 2016. This document looked at what can be done at the individual and community level during a pandemic when we don't have a vaccine or proven medical treatment for the disease. We're looking at data since 2016 and adjusting our recommendations to the specific circumstances of COVID-19. But this posted document provides a framework for our response strategy. Based on what is known now, we would implement these NPI measures in a very aggressive, proactive way, as we have been doing with our containment efforts. There are three categories of NPIs: personal NPIs, which include personal protective measures you can take every day and personal protective measures reserved for pandemics; community NPIs, which include social distancing measures designed to keep people who are sick away from others, and school closures and dismissals; and environmental NPIs, which include surface cleaning measures. NPIs routinely recommended for prevention of respiratory virus transmission, such as seasonal influenza, include everyday personal protective measures. These are preventive actions we recommend all the time for influenza season. Stay home if you're sick, cover your cough, wash your hands. These NPIs are recommended during a pandemic, regardless of the severity level of the respiratory illness. Personal protective measures reserved for pandemics include voluntary home quarantine of household members who have been exposed to someone they live with who is sick. Now I'd like to talk through some examples of what community NPIs look like. These are practical measures that can help limit exposure by reducing face-to-face contact in community settings. For schools, options include dividing students into smaller groups, or in a severe pandemic, closing schools and using internet-based teleschooling to continue education. For adults, businesses can replace in-person meetings with video or telephone conferences and increase teleworking options. On a larger scale, communities and cities may need to modify, postpone, or cancel mass gatherings. For healthcare settings, this might include triaging patients differently, looking at how to increase telehealth services, and delaying elective surgery. The implementation of environmental NPIs will require everyone to consistently clean frequently touched surfaces and objects at home, at school, at work, and at large gatherings. Local communities will need to make decisions about what NPIs to implement and when, based on how severe transmission and disease is and what can be done locally. This will require flexibility and adaptations as disease progresses and new information becomes available. Some of these measures are better than none, but the maximum benefit occurs when the elements are layered upon each other. Some community-level interventions that may be most effective in reducing the spread of a new virus, like school closures, are also the most likely to be associated with unwanted consequences and further disruptions. Secondary consequences of some of these measures might include missed work and loss of income. I understand this whole situation may seem overwhelming and that disruption to everyday life may be severe, but these are things that people need to start thinking about now. I had a conversation with my family over breakfast this morning, and I told my children that while I didn't think that they were at risk right now, we as a family need to be preparing for significant disruption of our lives. You should ask your children's school about their plans for school dismissals or school closures. Ask if there are plans for teleschool. I contacted my local school superintendent this morning with exactly those questions. You should think about what you would do for childcare if schools or daycares close. Is teleworking an option for you? Does your healthcare provider offer a telemedicine option? All of these questions can help you be better prepared for what might happen. CDC and other federal agencies have been practicing for this since the 2019 influenza pandemic. In the last 2 years, CDC has engaged in 2 pandemic influenza exercises that have required us to prepare for a severe pandemic. And just this past year, we had a whole of government exercise practicing similarly around the pandemic of influenza. Right now, CDC is operationalizing all of its pandemic preparedness and response plans, working on multiple fronts, including specific measures to prepare communities to respond to local transmission of the virus that causes COVID-19. Before I take questions, I want to address the issue of the test kits CDC is developing. I am frustrated, like I know many of you are, that we have had issues with our test. I want to assure you that we are working to modify the kit and hope to send out a new version to state and local jurisdictions
They're not even
soon.
working.
There are currently 12 states or localities around the U.S. that can test samples. As well as we are testing at CDC, 400 samples were tested overnight, and there is no current backlog or delay for testing at CDC. Commercial labs will also be coming online soon with their own tests. This will allow the greatest number of tests to happen closer to where potential cases are. Last, I want to recognize that people are concerned about the situation. I would say rightfully so. I'm concerned about the situation. CDC is concerned about the situation. But we are putting our concerns to work preparing. And now is the time for businesses, hospitals, communities, schools, and everyday people to begin preparing as well. Over the last few weeks, CDC has been on dozens of calls with different partners in the health, retail, education, and business sectors in the hope that employers begin planning to respond in a flexible way to varying levels of severity to be prepared to refine their business response plans as needed. I also want to acknowledge the importance of uncertainty. During an outbreak with the new virus, there is a lot of uncertainty. Our guidance and advice are likely to be interim and fluid, subject to change as we learn more. We will continue to keep you updated. I'd be happy to take a few questions now.
Brittany, we're ready to take questions.
Thank you. We'll now begin our question and answer session. If you would like to ask a question over the phone, please press star, then 1, and record your name clearly when prompted. If you need to withdraw your question, you may do so by pressing star, then 2. One moment as we wait for the first question. Thank you for your patience. Our first question comes from Lisa Desjardins from PBS. Your line is now open.
Good morning. Thank you for doing this. I have some more questions about the test kits. Thanks for what you just gave us the update on. But can you go into more detail about how they work? Can any hospital now just kind of use a swab to get a sample and then send that to the CDC? And then how long do you estimate it will take to have the kits replaced so that more localities can actually do the analysis? And then do you have enough money for this kind of field work and test analysis right now?
Okay, I'm going to actually start from maybe the part of a patient perspective, which is, right now our focus is still on individuals with a travel history that would put them at risk for COVID-19, or people who are close contacts of someone who has COVID-19. Those individuals, when they are identified by a healthcare provider, the healthcare provider calls the health department. The health department helps them triage those patients to make sure that the health department agrees that they have the potential to have COVID-19, and then the samples are worked with the health department. Now, as we move forward, though, if we are looking at the trajectory of expecting that there likely will be community spread of this virus in the United States, the case definition may change away from narrowly around people with travel. Again, that's what we would anticipate doing as there is community spread. If that happens, it will be more and more important that the clinicians have a full toolkit, and that's why the availability of commercially available kits would be so helpful. So in the short term, it's the clinician calls the health department, and either the health department already has the test kit themselves stood up, or if they don't yet have it stood up, they send it to CDC. Our turnaround at CDC is within a day. There is a little bit of shipping time, but that's the process. In terms of timing, I think at this point what I would say is we are working as fast as we can. We understand the frustration of our partners in the healthcare sector, of our partners in health departments, and you certainly...
Okay, so I just want to let everybody know what's going on with the test kits. What's going on with the test kits is they're not working. So they're either testing positive for people that are negative or negative for the people that are positive. So they're dysfunctional test kits. And anyways, I just, this whole thing is crazy. But I just want to say one more thing. This video is halfway done. It's 36 minutes. Actually, you can go onto it. It's RedX News. It looks like he needs some subscribers too. So let's go over here to the library. Right here, I just want to say right here, coronavirus. I got 64 videos so far, and I'm updating it every single day. So I have to run. I got to go to work. Be vigilant, prepare, have faith, but prepare for the worst, and don't think it's not here in the United States. Like, it's here, and it's more than what the government is saying it is. Like, I mean, we can't trust everybody, but I mean, the CDC is supposedly going to have it under control, so the only thing we can do is control it ourselves, like with what we do. God bless everybody, and get prepared.